Um, I wanted to say thank you so much to Grassroots North Shore for giving me this opportunity to talk a little bit about Planned Parenthood and some of the things that we are working on and focusing our efforts on in 2014. This What's at Stake for Wisconsin Women webinar is part of a weekly series that Grassroots North Shore is hosting for the next few weeks. We are recording it, and the recording will be available on the Grassroots North Shore website after we're done here, and hopefully I'll be able to make it available on the Planned Parenthood website as well. To start off, I do have a little bit of housekeeping. I wanted to let everyone know that everybody is on mute just to avoid feedback. Just webinars are fussy sometimes, so sound gets a little weird. So everybody is on mute. But there is a chat feature on the webinar. You can ask questions through that. Either later at the end, we'll open it up for questions, or if you have a question throughout the presentation, you can type it into the box in the lower left corner of your screen and then just hit enter when you are done typing, and it will be sent to me. And I will take them as they come in, and then we'll open it up at the end as well for whatever questions you have after I'm done speaking. So thank you again for joining, and thank you to Grassroots North Shore for hosting this. This is great. I think the agenda for the night, we're going to keep it short and sweet, so I'm going to talk a little bit about Planned Parenthood programs and services, just because I want to make sure everybody is on the same page with their knowledge about the organization. I'm going to talk a little bit about the legislative attacks against sexual and reproductive health care here in Wisconsin. I do want to highlight the Affordable Care Act, because Obamacare has done some pretty awesome things so far. And then I am going to close it out with ways that you can help out at the end. So we'll get started. So Planned Parenthood of Wisconsin is one of Wisconsin's oldest healthcare providers. We've been around for over 75 years. Annually across the state, we see over 70,000 people, and we have 23 health centers in the state. And 3 of those health centers are abortion centers, one in Madison, one in Appleton, and one in Milwaukee. But at the rest of our health centers, we are a reproductive health care provider and family planning provider. So we can do anything from life-saving cancer screenings, we do birth control, annual exams, STD testing and treatment, pregnancy testing and treatment, and we can even provide help to folks even if they just need a basic health checkup. They can come into Planned Parenthood and we can help out. We do have, Planned Parenthood likes to think of itself as a 3-legged stool. So we have our health centers, and then we have our education wing, which has been, they've named themselves Embody. So Embody is Planned Parenthood's educational and training program. With Embody, we are able to, we do professional training, so we can work with social workers, nurses, teachers, folks like that across the state to make sure that everybody is up to date with the most recent reproductive health care issues and research. We also do all sorts of workshops when we get invited into local schools, we get invited into churches, community groups. Our educators can talk about pretty much anything. They have workshops ranging from safe sex, contraception, birth control, pregnancy prevention, STDs, and then we even have expanded our work into making sure that folks and youth are using technology safely and making sure that people know about healthy relationships and domestic violence. So we have a wide range of educational services. We also, in our Embody program, we do have our resource library. It's the RITS Resource Library. It's the largest library in the state of Wisconsin for reproductive health care. It's based in Milwaukee, but it is available to anybody across the state. So if you know anybody that needs to do research for a paper, it's very popular for students if they have questions. We can answer that. We can send them resources about reproductive health care. And we also have what we call the Promotores de Salud program, which is based in Milwaukee, but we are expanding it to Madison as well. They are volunteer health educators. So we only have so many staff members who can be in the community. So our health promoters, which is what that translates to, they go out into the community. In Milwaukee, it's focused mainly on the Latina community, but they are volunteer educators, so they can talk about pretty much the same stuff that our educators do, just with a wider reach. It's a growing program. It's been growing every year, and in Madison, we're expanding it to not only the Latina community, but also the African American community. So we have dozens of educators across Madison and Milwaukee that are helping us with our outreach. Our education department is based in Madison, Milwaukee, and Appleton. Hopefully, we'll be able to say we're statewide in the future, but right now, we're based in those 3 cities. And then in Milwaukee, we have what we call youth program or youth educators. So they are a group of teens and young adults who work in our health centers, and they are available for the youth who come in to see us in our health centers who may not want to speak to one of our nurses, but would rather speak to a peer. So it's a peer-to-peer education program. And I think we have 5 educators in Milwaukee right now working in our health centers. So our education program is ever growing. And then the third leg of our stool is the public affairs department, which is the community outreach department. That's where I'm housed. We do advocacy to protect and expand access to reproductive health and rights. So we work with a volunteer base in Milwaukee, in Madison, Appleton, Green Bay, Oshkosh. We do community outreach and education. So here in Milwaukee, I'm sure folks in the Milwaukee area are quite aware that we are fond of our street festivals. So Planned Parenthood is at almost all of the street and neighborhood festivals, talking to folks in the community about sexual health care. We are also able to do legislative work. So that's what I'm going to talk about in just a minute. But we are able to lobby on behalf of reproductive rights. And then the big thing that my department can do is that we can also do electoral work. So we can endorse candidates who are supportive of sexual health care and the full comprehensive range of reproductive health care. Another little fun piece is that we work with student groups on 6 different campuses across the state. So not only are we in the basic community, but we have youth and young adults who are doing education and advocacy on campus communities, which is really big. In the state of Wisconsin, we have over 292,000 supporters. So we are a huge pink army of supporters who want to spread the good word about Planned Parenthood. Let's see. Challenges that Planned Parenthood is facing. I'm sure if anybody turns on the news in any given time here in Wisconsin, you will hear about some of the things that Planned Parenthood is facing. In my personal opinion, I think our biggest challenge is the misinformation among community members. When people think Planned Parenthood, the first thing they think of is abortion, and in Wisconsin, that's less than 1% of what we do. Over 98% of what we do is preventative services like those cancer screenings, the birth control and the STD testing and treatment. The other challenges that we're facing is our funding issues or the lack thereof, and then the political attacks. Governor Walker and the legislature right now is not very friendly to reproductive and women's health care, so we are constantly battling bad legislation. So to get into that, Governor Walker in the past 3 years has taken one of the most detrimental actions towards reproductive health care. In 2011, he defunded Planned Parenthood, which means that he ended our relationship with the state. Because of our defunding, we had to close 4 health centers last year, and those are 4 of our rural health centers. So it was Chippewa Falls up in the Chippewa Valley, Beaver Dam, Johnson Creek, and Shawano, which is just north of Green Bay. So those 4 health centers we saw about 12,000 people every year, and that's 12,000 people that now have to travel to get just their basic health care. Governor Walker has also eliminated access to cancer screenings, the annual exams for tens of thousands of patients through the BadgerCare cuts that we've seen this year. The Planned Parenthood's relationship with the state lab has been restricted or ended, so that cuts our ability to provide cancer screenings when we do those annual screenings for women. Colposcopy funding has been slashed, which is the cervical cancer screening. And then one of the bigger things, too, is that Governor Walker rejected federal dollars when it comes to the Affordable Care Act to expand access to health care. So he rejected federal dollars. So our state funding, our state health care is not looking as good as other states that took the federal dollars. This most recent state budget was also pretty ugly. There were cuts to the BadgerCare program, and BadgerCare is the state health insurance program. So in the past, anybody who was 300% of the federal poverty level was able to access state health care, and that was recently cut down to 100% in the state budget. So that equals, in this slide you can see, anybody who makes more than $11,490 cannot access the health care that they may possibly need. So for a family of 4, that's $23,000 a year, which is absolutely ridiculous. So the cuts to BadgerCare will affect nearly 90,000 parents, and it just adds to the tens of thousands of people in Wisconsin that need access to health care. What's next? Abortion restrictions. Governor Walker and the legislature they've been very busy restricting access to abortion. So I'm not sure if everybody has heard of it, but Act 37, which was SB 206, it's known as the forced ultrasound bill. This bill was passed in July. It forces ultrasounds on women who are coming in for abortion. Ultrasounds are considered best practice, but now they are forced. Another section of Act 37 requires doctors to have admitting privileges to a hospital. Doctors who provide abortion care to have admitting privileges to a hospital within 30 miles of the health center. This is an incredible piece of legislation. It's happening across the nation, and Planned Parenthood is actually in a lawsuit against the state right now because of these admitting privileges, the requirement for admitting privileges. Abortion is now the only outpatient procedure in the state of Wisconsin that requires this, and it essentially would shut down half of the abortion clinics in Wisconsin, which there are only 4 clinics specifically that do abortion care. 3 of them are Planned Parenthood centers. But because of our lawsuit, we have been granted a temporary injunction, so we are able to continue our care as normal before. We are still in the middle of the court proceedings, but and we're hoping that in the next few months it will be decided. But for now, even though this law has been signed and is in effect, we have an injunction, so so we're still able to provide care as normal. Another piece of abortion restriction legislation was SB 202, which eliminates insurance coverage for abortion and birth control. And this is specifically, it's taking away existing health insurance that people may have already had in the past. And it also is ending a requirement that says that any insurance plan that offers prescription coverage also must cover birth control. That was revoked in SB 202. So, and then SB 201, the sex-selective abortion ban. That is something, I don't think that's been voted on. It passed the Assembly. It has yet to go to the Senate. But it's just another restriction that does nothing really to help women prevent unintended pregnancy. The folks who introduced it says that it helps prevent gender discrimination, but sex-selective abortion isn't the way to do that. If we want to work on gender discrimination, we should focus on things like equal pay and access to comprehensive health care and full-on insurance. And this is just a short list. Like, we're expecting more to pass this year, which we're constantly watching, so we'll see what happens. But on the upside, President Obama signed the Affordable Care Act that went into effect fully on January 1st of 2014. And this slide just shows a few of the things that it does do to help women and reproductive health care. Women can access birth control with no copay anymore. There's no more gender rating. So in the past, insurance companies could actually charge women more for the same plan that men had just because they're women. Insurance coverage of preventative services. A big thing for our college students and younger folks is that they can stay on their parents' insurance until they're 26 now. I think Kevin Kane has spoken to you all about the Affordable Care Act, so I won't go into many details, but being on your parents' insurance until you're 26 is huge. I'm jealous that I was not able to do that. And then a huge thing, too, is that it ends, you can no longer be denied insurance because of a pre-existing condition. And a pre-existing condition can be anything from asthma to a woman who had to go through a C-section because she was having labor issues, so she had to have a C-section. Asthma, domestic violence is a pre-existing condition to insurance companies. So as of January 1, insurance companies can't turn you down because of those things. So the last thing I wanted to say before I start reading through the questions in the chat, what you can do to help us, you can start volunteering with Planned Parenthood. We just kicked off a new legislative campaign last week. We're calling it We're Talking About Women's Health Wednesdays. We're encouraging our supporters and volunteers to call Governor Walker every Wednesday to let him know that folks care about reproductive health care. He recently spoke to a reporter and says that asking about women's health care is ridiculous because when he's in the state, nobody ever talks to him about health care and birth control. So we want him to know that people do care and people do want to talk about it. So we're encouraging folks to call every Wednesday for the next 10 weeks, which is the legislative session. So that's just one way to get involved. Sharing your story is an incredible way to spread the truth about Planned Parenthood and the services that we provide. A few years ago, we saw that having 100,000 people outside of Capitol doesn't get through to legislators. So the best way to talk about these issues is to share your story because Planned Parenthood is the healthcare provider for 1 in 5 women. So I'm sure pretty much everybody on this phone call probably knows somebody who has been a patient to Planned Parenthood or has volunteered with us. So we're a very big organization. Letters to the editor are always very helpful. That's a great way to get our messages across and through information to the masses. And then I did want to include our online connections since you're all online right now. We do have a website that outlines all of this, ppawi.org. We are on Facebook and Twitter for those of you who are on the social media. And one thing that we're trying out is text programming. So if you're interested in getting legislative updates from us through text to your phone, you can text Wisconsin to 69866, and that will add you to our text program. So those are just a few ways to get involved. We always have events, well, not always, but we have a lot of community events to bring people together. And the best way to keep up with what we're doing is to visit our website. It's updated on a daily basis, so ppawi.org. And then, just so you all have it, my email address. So if you do want to volunteer or you do have questions that come up after this webinar, you have a chance to get a hold of me. That's my email address. And I'm really bad at turning my email off, so I will probably answer you any time of day. So my name again is Molly Swank, and my email is molly.swank@ppwi.org. And that's all I wanted to share through the PowerPoint, and I see that some questions have come through while I was talking. So I'm going to start with those, but if you have any questions, please, again, the chat at the left-hand corner of the screen is the best way to do it. Just type in your message where it says type your message and hit enter, and I will get to as many as I can in the next 10 minutes or so. So Nancy asked what laws about reproductive care are being challenged in court. Right now we are, like I said earlier, the lawsuit against Act 37, which is the Admitting Privileges Bill. We are doing everything we can to make sure that we can provide care at all of our abortion health centers. And then we also are in the middle of a lawsuit with the state in regards to our medical abortion services. That is, there was a law was passed last year that was very vague in wording about doctor's visits and follow-up visits. So in order to ensure that we're a healthcare provider, we want our patients, and protecting our doctors and patients is our main concern. So for a while last year, in 2013, or maybe it was 2012, we suspended our medical abortion services. Those have been restored with an injunction, so that lawsuit is also still being challenged. So we're currently in the middle of two different things. Let's see, Martha is AUL behind the attacks on Planned Parenthood and funding Walker. I'm sorry, I don't know what AUL is. Martha, so if you want to clarify, if you want to clarify what that is, I will try to answer it tonight. If not, if you can always email me and I'll let you know. Martha also asked if there are handouts about the Wednesday actions. Yes, I have more information that I can send out to you. I didn't want to include it in here because I didn't want to be too text heavy or anything, but just send me an email and I can get you hooked up with all of the information that you'll need. We have phone numbers, background, talking points, sample scripts. So we have everything that you need to make sure that it's quick and painless when you call the governor, because he needs to hear from all of us. I got a question from Joe. What to say to someone who says he is for choice but against government funding because it violates the rights of those opposed to choice? Well, the quick answer to that is that no government money no taxpayer dollars can go towards abortion because of the Hyde. I think it's called the Hyde Law, Hyde Amendment. But Planned Parenthood, we keep very strict walls between our abortion care and our family planning care and our legislative work. No tax dollars can go towards abortion. So that's the quick answer. And Planned Parenthood does everything that we do, everything according to state law. We are very, very, very careful about following the laws when it comes to that. Let's see. Oh, Americans United for Life. That's what AUL is. Thank you, Nancy. That I'm not really sure. There are a handful of anti-choice organizations that are working with legislators and folks in the Capitol to pass these abortion restrictions. It's hard to say where exactly it's all coming from, though. Oh, few of you answered. Thank you. I think those are all the questions I've gotten so far. Let's see. Kathy made a comment. Amazed to learn that Planned Parenthood provides care for 1 in 5 women in Wisconsin. Yes, we have touched many women at our 23 health centers. Before that, it was 27 health centers before we got defunded. So we have health centers across the state in rural areas, as far north as Eau Claire and the Fox Valley. In the Milwaukee area, we've got 6 health centers, including one in Waukesha. So we've got lots of health centers in the area, and in Madison we have 3 health centers. So we have seen we've touched a lot of folks, and hopefully we will continue to be able to provide this care into the future. thanks to supporters like you and our friendly legislators. So I'm going to give folks just a couple more minutes to ask some questions. So I hope I've touched on everything that you all may have had questions coming into this for. I do hope to present at another webinar, another Thursday webinar in the next couple months to go a little bit deeper into some of these issues. Ooh, some more questions. Joe asked, what's the single best way to approach a persuadable voter on these issues? Honestly, the best thing to talk about is how important access to health care is. I mean, if we can't take care of ourselves fully, I mean, how can we be productive in society? How can we be productive at work? I think when it comes to Planned Parenthood, it's important to talk about how over 98% of what we do in the state is preventative. It's cancer screenings, it's birth control, it's STD testing and treatment. So we just want to make sure that folks are taking care of themselves and have access to all of the education and all of the medical care that they need to stay safe, healthy, and strong. Kathy asked what percentage of patients are under the age of 18. I'm not sure of that number off the top of my head. That is, you can check into our annual report, though. That has all of our demographics and statistics in there. So if you want to email me, I can get you a direct link that's online. Otherwise, you can visit our website. What about the Supreme Court and the 35-foot law? I believe that's in regards to buffer zones. That is something that we're watching here in Wisconsin. We don't have such a thing as a buffer zone. So at our abortion clinics, luckily in Madison and Appleton, our abortion centers are on private land. So protesters can't really access patients as they're walking in the building. Unfortunately, in Milwaukee, our abortion clinic is right downtown. It's in the 3rd Ward, kind of by Summerfest, if you will. We have protesters right outside the door. We do have an escort program to help folks get in if there are a lot of protesters outside, but we do everything that we can to make sure that our patients feel comfortable and safe walking into our doors. Let's see. Nancy asked about challenges to the forced ultrasound bill, and as far as I know, nothing has been decided. Here in Wisconsin, we actually can't challenge that portion of the bill, just because, actually, I'm not entirely sure why we can't, but I know that there's something in the law where it's best practice, and we're more worried about the admitting privileges portion. And Nancy asked, in one of the slides I mentioned that Planned Parenthood can no longer use a state lab for cancer screenings. As far as I know, the Governor Walker did end that relationship. I don't know. That's something I need to check in on. I'm not sure where that stands right now. So, Nancy, I can get back to you more on that once I look into it. Martha makes a comment, prevention saves so much money instead of care. I did want to note that. It's true. From the dollar standpoint, $1 of family planning services saves the state $4. So that's another fun number. For every $1 that they put into family planning programming and into BadgerCare family planning programming, it saves taxpayers $4. So, Kathy asks, if we donate to the Planned Parenthood national office, what percentage goes to Wisconsin? That is a good question. I'm not entirely sure how that gets split up. I know that we, in the state of Wisconsin, are obviously part of the Planned Parenthood family, so we work very closely with the national office on all of our legislative work and all of our educational work, but I'm not exactly sure what the percentage is among Planned Parenthood affiliates. If you, I'll make the pitch. If you are interested in donating directly to Planned Parenthood, you can go to our website, PPAWI, or you can email me and I can send you a link or something in the mail if you would prefer to do it via mail. That's the best way to make sure that your donation goes directly to the care in your community.
Molly, on behalf of Grassroots North Shore, thank you so much for your presentation today.
Yes, thank you so much. It's been great. I'm glad that you're able to host these on a weekly basis, and I'm really excited that you thought of Planned Parenthood. So thank you.
I'm looking forward to your next one. Thank you.
Great. Thanks all.